A classic strategy of government overreach is to create new rules by redefining terms in existing law. It's very efficient. Instead of having the people's representatives pass new laws, the people are simply informed what their laws now mean. Never mind what the laws meant when they were passed. Nowhere is this more evident or more dangerous than in the recent rush to squeeze gender identity into the legal definition of sex. Early in President Biden's term, his Department of Health and Human Services announced that it would begin interpreting existing laws on sex discrimination in a novel way. Going forward, Americans were told, the HHS understanding of sex discrimination would include sexual orientation and gender identity. This is a drastic change that will affect the lives of most Americans. In fact, for many doctors, few changes could have a more profound day-to-day impact. That includes physicians like Dr. Quentin Van Meter, a pediatric endocrinologist who has been practicing almost 50 years and who is on the clinical adjunct faculty of Emory University and Morehouse College Schools of Medicine. It also includes Dr. Rachel Kaiser, an emergency room physician who serves patients in Tennessee. These frontline physicians are absolutely dedicated to caring for their patients. Key to that is recognizing the biological reality of the sex of their patients. But with these new definitions, Doctors Van Meter and Kaiser would be required to provide gender transition drugs or surgeries, regardless of whether they think that's the right course of action for their patients. Even suggesting alternate approaches could be forbidden as examples of hostility. Doctors who refuse to comply will face massive fines and may be compelled to stop practicing medicine altogether. That's an ideological attack on the consciences of countless physicians, freedom of speech, and biology itself. Doctors often disagree with each other about what treatment is right for a patient. That's normal within the field of medicine. What's unheard of are laws that force doctors to administer treatments they don't agree with. If two heart surgeons disagreed about an operation, the government wouldn't force the dissenting surgeon to perform that surgery. Yet in the case of gender dysphoria, HHS is doing exactly that, and on a course of action that's both experimental and highly controversial. This policy tramples on physicians' sacred right to care for patients according to the doctor's best medical judgment and the dictates of his or her conscience. It violates the Hippocratic Oath to do no harm. The government should never punish medical professionals for refusing to break that vow. Yet that's exactly what could happen to these frontline heroes who simply declined to participate in an experimental, irreversible, and highly controversial procedure that they believe to be unnecessary or even harmful to their own patients. And that raises another concern. This policy puts patients at risk. As the administration now reads the law, physicians are forced to speak and write about patients using their chosen gender identity, not their biological sex. This includes not only using preferred pronouns, but also rewriting biology in their medical records. Falsifying medical records, an obvious and illegal breach of ethics, can lead to life-threatening results. That's not hypothetical. In one case, a baby died during labor after the hospital wasn't told that the patient, who identified as male, was actually a pregnant woman. We should expect to see other highly avoidable tragedies like this if physicians are forced to turn patients' records into cultural propaganda. There's no medical justification for this coercive, dangerous decision by the government. It's the predictable fruit of an ideological tunnel vision that crushes all dissent. Instead of heavy-handed government actions like this, we need dissent, now more than ever. The West is facing an explosion of gender dysphoria, particularly among girls from 12 to 15, who are 1,000 to 4,000% more likely to identify as transgender compared to that same age group just 10 years ago. Story after story is surfacing of girls who were rushed to transition and now regret the life-altering procedures medical providers didn't hesitate to perform. What should our response be? The answer to that question is far from settled in the medical field. If HHS makes it illegal for doctors to question the speed and trajectory of this crisis, many of our most vulnerable patients, our sisters, daughters, and neighbors, will be stripped of the ability to seek a second opinion that might spare them a lifetime of regret. Fortunately, brave doctors are stepping forward to stop that from happening. With the help of Alliance Defending Freedom, the American College of Pediatricians, and the Catholic Medical Association, where Doctors Van Meter and Kaiser are members, along with thousands of fellow physicians, are challenging this radical redefinition of sex and the disastrous consequences that flow from it. Their argument to the court is clear and vital. Allowing bureaucrats to mandate a politically charged diagnosis is no way to practice medicine. It's illegal, it's dangerous, and it must be stopped.